Melissa Lee. Today we're going to talk to you about the Nevro spinal cord stimulator trial. We're putting together this video because we've had a lot of patients who ask about different questions during their trial, what to expect, what not to expect, what are the concerns, dangers, and how the trial goes so they can really get the best experience. We're down here in South Florida in Fort Lauderdale. I'm at Holy Cross Hospital. If you want to learn more, you can also go on my website, internationalhouseofpain.com. So we're going to start with a few questions for Melissa. The first one is, the patient often says, my rep gave me a schedule, and do I need to test all the settings, and when do I change it? What should I do? I've got this box, and how do I go about using it?
Okay. Good afternoon, everyone. So it's very common that your representative may give you what we call a trial program schedule. It may look like this. And the reason why we give you the trial schedule is just to help you understand that at times we may need to test different settings to identify which setting is best for your pain relief. However, the biggest misconception is that patients believe that they must test every setting that is on the schedule, and that is not the case. What we are looking for is to identify where we begin to get pain relief. So one of the things that will be written on your schedule is that pain relief may not be immediate. We find that with the Nevro trial system and the permanent system, it can take a few hours, at sometimes a few days, 1 to 2 days, to have the full effect on one particular setting.
Even if you're in the right spot?
Even if you're on the right spot. So what we ask patients to do is to stay on a setting for a set period of time. Now that period of time will be determined by your rep because each patient is unique and their pain is unique. However, a general rule of thumb is to leave each setting for somewhere between 24 to 48 hours, adjusted as needed by your representative. Now, if you get pain relief on that initial setting, your rep will not recommend any changes. So it is possible that you will only use one setting during your entire trial period. That means we found the sweet spot on the first try.
What if it's only a 45%?
So if it's only a 45% relief, we actually will leave that setting for a longer period of time to evaluate whether that is a plateau at 45% or if it's still building up therapy. After a reasonable amount of time, we would instruct a patient to adjust their setting according to their schedule to identify whether the next step in the program would help them achieve a greater than 50% relief.
And that's the goal, is 50%?
The goal is a minimum of 50% relief to identify whether or not their pain is responsive to neuropathic pain. Now, that doesn't necessarily mean that that is the only amount of relief that they will get, but during the trial, what we want to see is a sustained level of a minimum of 50% relief. Now, it is possible down the road to explore to see if you can achieve greater than 50%. But initially, we want to have sustained, lasting relief over a period of time during the trial.
So let's say you're at 50%. Would you then think you might be close and you try a different program to go nearby?
It would depend at what point they're in the trial. If they're on the last day of the trial, then that would limit us due to time constraints. However, if you're in the middle of the trial, we can certainly test the next setting to evaluate it. Now, what can happen is if you continue to explore, you may go past the therapeutic value and actually begin to lose relief. So that is why it's so important we make notes on what you're getting on each setting. So if we explore beyond that setting, we know that we can come back to, I call it home base. We know where home base is located. But if we don't stay there long enough, then we don't know how much therapy you get on that setting, which is why we ask patients to stay on each setting for a period of time.
So what I'm hearing is that if you don't get immediate relief, or even if you don't get relief for several days, there's still a lot of hope that if you just keep moving to the next place, but taking good notes along the way, you may find the sweet spot ultimately, and not to get despondent or worried.
Absolutely. So I have both types of patients. I have had patients that on the very first day, immediately that evening, they had pain relief and we stayed on one setting. I have had other patients that we actually went through an entire programming algorithm with them that was over a series of days, 5 to 7 days, and they were able to identify their sweet spot, which just happened to be on a different setting. But we go in an organized fashion with an important value of time to evaluate each setting. Because how the patient gives us feedback, that actually helps us identify what setting is going to be best for them. I want to know, how is your pain score? What is your percentage of relief? Have you noticed a change in your sleep habits or your sitting, standing, and walking? The patient I'm thinking of that responded on day 6, he happened to just spontaneously walk in the park. It was the first time he had done that, and he hadn't even realized that he was feeling so well. If I had asked him on day 2, he was a little bit discouraged. And so we ask patients, be patient and follow the schedule through the process, because we will use every single day we're going to ask you for your feedback. That's going to help us put the puzzle together for your particular pain.
Kind of sounds like a manhunt to me, where you start searching in the area where you have the highest chance of finding that either treasure, person, or success, and then you kind of systematically move away from that highest likelihood, hoping that you're going to run into the thing you're looking for.
That's exactly. So one of the things I like to highlight on the schedule with patients, and I'll just read it right off the schedule for you. When you get sufficient pain relief, make no further changes. I had a patient the other day tell me, I was feeling great on setting XYZ, but your schedule said to change it on the next day, so I changed it and now I'm feeling worse. And the question I asked the patient, why did you change it if you were feeling well?
Yeah.
And he said, I just thought I was supposed to test all the settings. So that is the reminder that when you get sufficient pain relief, we want you to stay there. Now, the next line says, if no pain relief, absolutely, we will move through the programs as directed, as prescribed at the appropriate time lengths.
Well, that's kind of tough because, knowing what is sufficient is hard. Some people may say, I definitely feel better, but I sure would like to feel even better than that, and be tempted to go on. How do you counsel someone who's saying, I feel definitely moving in the right direction, but it's not, I really would like more?
This is what I tell patients, take good notes, okay? We may recommend that you go ahead and move forward, or it's the patient, they have the remote control. Some patients, they do on their own go beyond and test it. You can always go back to your home base.
Okay.
The mistake that is common is that patients will turn it up, turn it down, change it up, down, back, forward, and they don't really know where they're responding, because remember, there is a later effect or latency period
effect
that happens. And so as long as you're going in a order, going from one step to the next step, everybody wants to try and get more. There's nothing wrong with that.
Right.
Just know where your home base is and we can bring you back.
Okay. So patients, what happens if they get a new pain, or what if their pain is getting worse? How do you respond to that?
So anytime we see new pain, worsening pain, or just an unusual sensation, we know that that is not the ideal setting for the patient. So the initial recommendation is to turn their setting down by 1 and call the rep. We can solve that very easily by simply bringing it down by 1 setting. So that can happen with a patient who's feeling pretty good. I had a patient saying she had about 75% relief and just wanted to get past that hump, and so she took the next step in the schedule, which was fine. She found worsening. She was actually losing her pain relief. She dropped it down back 1, said, Melissa, I would have never thought to turn it down, because patients think more pain, more stimulation, and that's actually not the way we see it.
Well, hard time in Texas where more is always
Bigger is better.
So what's the difference between like this program 1, 2, and 3? What's that mean?
So on your schedule, you'll see program 1, 2, and 3, and some patients will believe that that is better or worse, stronger or weaker. They are simply different locations. In the example of a manhunt, we believe that program 1 is the best place to start, and we will explore beyond to program 2 and to program 3 as needed. However, program 3 is not stronger or better than 1. It's simply a different location.
All right. And so what are the these setting lights at the top? mean?
So on your program schedule, you'll see a line that says setting, number of green lights, and your rep will put a number in there. That is the same thing as intensity. So you can go up to 7 lights and as low as 1 light while still having therapy. We will typically ask you to test somewhere in the middle. However, more lights does not equal more pain relief. It is simply different. Just like different medications have different dosages, more is not always better. At times a patient may need more dose or less dose of stimulation, and that's why talking with your rep and telling them how you're feeling, giving that feedback, will help us direct you where it would be best.
So what would be the side effect or effect of too much stimulation?
If a patient has too much stimulation, it would be characterized by just a discomfort in their usual pain. It seems to be more noticeable, or it could just be a sensation of just difference. They just feel a little different. Not bad, not terrible, nothing wrong. They just don't quite feel as comfortable. And so the solution is simply turn it down by 1 light.
Interesting. And if they have any questions, just call you.
Absolutely.
All right. So now the remote is off at some point. What does this mean? Does this mean no stimulation? Does this mean stimulation? What's going on?
So the remote control will only be active when you're using it. And typically in the trial, you do not use it more than once or twice a day. So what you want to look for is, this is the trial stimulator belt that you wear around your waist. In order to confirm whether your stimulation is on, there is a green light right here. When the green light is flashing, you know therapy is being delivered. When there is no green light, which it is not flashing right now, that means therapy is off.
And that's why I heard.
That's why you heard. That's right. So we ask patients to check that the light on the trial stimulator is flashing, and to simply call your rep if for some reason it's turned off. What can happen is there's this little emergency red button. If that button is pressed by mistake, it will turn off your stimulation. Doesn't happen often, but it can, and it's an easy fix.
Now, this cable plugs into that box.
It does.
Do we always keep it plugged in?
So I would prefer that you always keep it plugged in. However, we have some restless sleepers that I call them flip-floppers at night, and sometimes this can become dislodged.
Okay.
If that is, it's as simple as, similar to an old-fashioned telephone jack, it just plugs right back in. Your rep is going to identify which cable should go in which side, and again, when in doubt, just call your representative. This is a very easy fix.
Now this thing is coming out of the patient's back, this lead, it gets plugged into that cable.
Right. So the patient typically does not see the lead that is in their back. The patient usually just sees this white cable. This will be underneath a bandage. Again, from time to time, with enough force, the unit is designed that it would release from here rather than at the surgical site. If that's the case, your rep can either meet you in the office to help what we call reseat the lead, or if you have someone at home that can help you, we can easily talk them through resetting it.
Okay. Is that easy?
Very easy.
All right. Anything else that you want to talk about?
I think the most important thing is that you remember to take good notes and to give feedback. Your representative is going to ask you about your activity level, your sleep, if you have maintained your physician's direction on medication, and note any changes and be patient through the process. We do the trial over 5 to 7 to 9 days for the reason that some patients need different settings tested than others.
All right. Well, let me also add, on my part, during that time, you must be taking your antibiotics. It's very, very important. And if there's a problem with the antibiotics, you got to call us. If there's also any trouble during the trial, a change in your normal neurologic ability, say, for example, weakness in your legs or change in your sensation, where you're losing sensation or getting weaker, that is actually an emergency. It's an extremely rare emergency, but it may mean that there's a little bleeding within the spine. And I want patients to call us. I don't care if it's 3 o'clock in the morning on Sunday. I want to know about it immediately. It's an emergency that can be fixed completely if treated appropriately. And also, on the same note, if the antibiotic for some reason has to be stopped, we need to know. If you're getting sick, if there's a reaction to it, or if you're, say, getting nauseous from it or have loose stools, we want to know we can change you or the patient to a more suitable antibiotic. but just don't stop it and not tell us. Those are the two main things from us that we're concerned about. So thank you very much.